we don't expect a 4-year-old to have perfect R's,
right.
Or S's, for example, especially like my children who don't have any teeth right now.
That's not a West Virginia thing, by the way. That's just an age thing.
Yeah. That's a 6-year-old thing.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
Back with a brand new episode of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Michael Squires.
In today's show, Dr. Michael is going to, however broadly, explain what he is, an audiologist, and how that differs from a speech pathologist.
Yep.
The inspiration for our episode today comes from the article written by Dr. Lisa Bragg of Clarity Audiology and Hearing Solutions in Ellicott City, Maryland. So, Dr. Michael, I guess my question to you is, who are you and what do you do and how is that different from other people?
Boy, that is painting with a broad stroke.
10 minutes.
Yeah, broad as they come. So I will say, anybody who's watching this should, if we link that article, they should go and read that article.
Okay.
She did a great job of differentiating between the two. I don't know in 10 minutes that we can realistically break all of it down in its individual parts and pieces.
I think of it like this. What we do on this podcast is to incite and instigate the conversation and then
I like that.
Absolutely usher people towards the rest of the articles that help finish it.
Yep. I love it. It's a good article. So I work with speech pathologists in practice. Mm-hmm. And so I'm an audiologist and I specialize in hearing and vestibular issues, right? Hearing, tinnitus, and balance.
Yeah, give us your resume, essentially.
So, so I have a 4-year doctoral degree and a 4-year undergraduate degree.
Got it.
So I have a bachelor's in science in speech and hearing sciences, and then I have a 4-year doctoral degree in Doctor of Audiology, right? So essentially the difference from an academic perspective, there is differences in schooling. Mm-hmm. The entry level in audiology is a doctoral level. So whether that's what's called an AUD, which is a clinical doctorate, PhD, which is a research doctorate. In some cases, it's a educational doctorate, an EDD. And so that differs from speech pathology in the sense that while those secondary degrees are available, PhD and so forth, the entry-level degree into speech pathology is a master's degree. Okay. So typically a 2-year postgraduate degree.
Got it.
And so that's really the similarities end in undergraduate.
Okay.
Most all of us have some type of a background in speech and hearing disorders, communication sciences and disorders, something like that.
So let me ask a question.
Yep.
As the untrained party in this room, when, could I come to university and be like, hey, I don't know what I want, but like speech pathology and audiology are on a path before they diverge?
Absolutely. Okay. So for example, I went to West Virginia University. I had a bachelor's in speech pathology and audiology, right? And so realistically, for that first 4 years, it's all introductory courses. We're talking about things like neuroanatomy. Those of us who are interested in audiology are learning about speech and vice versa. And so we go through that whole undergraduate process together, which provides a really nice foundation for deciding what we want to do past that. We get a lot of students through our clinic who are observing and, we're trying to talk them into coming over to the dark side, right? We're like, you don't want to go to speech, be an audiologist. And I'm sure there's a lot of speech pathologists out there doing the same thing.
Of course.
So we have a silo in our practice or a branch of our practice that works in educational audiology, and we work really closely with speech pathologists.
Got it.
So the difference in practice, right? We are ears. We are doctors of the ear, right? Or I should say doctors of hearing. Whereas we're non-medical, right? We don't have a medical degree, so we're not doing surgeries. We're not prescribing medications and things like that. We rely on our medical partners, ear, nose, and throat, otology, primary care in some respects. So we are diagnosing and treating hearing disorders, but also vestibular and tinnitus. We have the ability to screen for some of those articulation disorders and things like that. Whereas those speech pathologists, those are the ones in the weeds. They are in, and I'm going to paraphrase this because they do a ton of stuff. So articulation disorders, fluency, language disorders, and this is across the lifespan.
Is articulation like enunciation?
Yeah,
proper diction?
Yes.
Okay.
I mean, to the layman like us.
Yeah.
Yes, I think that's a good way to describe that. Articulation is, it's when a child has a lisp, for example, right? And so while they're in grade school,
or like they don't pronounce their R's or something.
Yeah, exactly. And some of that is age appropriate, and so we have to be realistic on what we can expect from the kid.
Sure.
We don't expect a 4-year-old to have perfect R's,
right.
Or S's, for example, especially like my children who don't have any teeth right now.
That's not a West Virginia thing, by the way. That's just an age thing.
Yeah. That's a 6-year-old thing. But speech pathologists work, like I said, birth all the way up to an older population. And so, and it even progresses into things like swallowing disorders, right? Cognitive disorders as well. And some of it is just even social cues. I mean, they do a whole lot in terms of communication. Yeah. And I think that's the point to drive home, is that we are both professionals in a communication field, but we are approaching it from different perspectives.
Sure.
The ultimate goal is to work together. Yeah.
So I get this. So then my question would be, and you cannot speak for everybody who's decided to be a speech pathologist, and you certainly can't speak for everybody who's decided to be an audiologist, but for you, what was it about audiology that was a little more enticing than speech pathology?
Yeah, that's a really good question. I think in terms, for me anyway, it was just all of the assessments, right? And so I just remember the Goldman-Fristow. I remember that's what stuck in my head from undergraduate school.
The Goldman-Fristow?
Yeah.
What is that?
It's a assessment for articulation disorders. And so I remember thinking to myself, I can't do the Goldman-Fristow my whole career. I can't do this over and over. But it goes so far beyond that, right? Sure. That is such a surface level thing. I don't know. I have a background in audiology from my family. My father was an audiologist. My sister's an audiologist. So I had a lot of influence from that perspective. And I was just always around people with hearing disorders. So I felt an attraction to that.
Got it.
Not to mention my now wife was going into audiology. So,
sure.
I had a gentle.
So now we finally figured it out. Has nothing to do with family. Has nothing to do with Goldman-Fristow. It was there's a really pretty girl who I wanted to sit next to.
Well, that was certainly a strong factor.
Okay.
Yeah.
Fair enough.
I always tell people that our apples in our family they fall directly to the bottom of the tree and rot right there. We don't branch out too much.
I love it. So for you, it feels like and again, this is anecdotal from what I know, just kind of being in the industry as a podcast host, is there might be a little more clinical medical stuff that comes with audiology, where speech pathology, you are working one-on-one with somebody for a very prolonged period of time, and you're not necessarily, and I don't even know how to phrase it, but you're not wearing the white coat showing up to a practice necessarily, right?
Well, not necessarily. And in some cases, so one of my really good friends owns a private practice as a speech pathologist. And so what she does is she's got a huge staff. She contracts out to school systems, but so that would be kind of an outpatient perspective.
Sure.
There are inpatient speech pathologists that work in the hospital with swallowing disorders and things like that.
Got it.
They work hand in hand with ear, nose, and throat physicians doing barium swallows, and I'm just shooting off the from the hip here, and they're doing supervising or they're being supervised with endoscopy and so on and so forth. So again, 30,000-foot view, but they have a really, really wide scope. There is a period where our scopes kind of cross. They're, like, for example, in the school system, they're doing basic hearing screenings. So they're the ones that are helping to monitor for ear infections and things like that when they're doing school screenings, and then they would be the ones to refer out to us to do the diagnostic work. On the other side of that, we see a lot of kids, for example, in my practice, we see a lot of kids through West Virginia Birth to 3, the Birth to 3 program, and all of these, every state, I believe, in the United States has a early detection program for childhood hearing loss. And so those programs contract with audiologists and speech pathologists. And so before they'll do an assessment or before they'll start with formal speech pathology, or therapies, they'll refer out to an audiologist just to make sure that we're not missing a hearing loss. So we do work, in many cases, hand in hand.
Well, and as you mentioned, like undergrad, that was your bachelor was speech pathology and audiology, right?
Yep.
And then eventually you just got to choose.
There's definitely an overlap there because the population of people needing speech pathology services, a lot of those patients have hearing loss. So, they're trained to recognize those signs and symptoms as well and refer over to us just the same as we're trained to recognize some of those things and send them their way.
And now that Dr. Michael has properly defended his professional choice, if you want to read more articles like we discussed today, which you should, please visit our website, askanaudiologist.com. So Doctor of Audiology, Michael, thank you so much.
Yep, happy to be here. Thanks a lot.
We'll see you guys next week.
Take care.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
I love the video thing because when we see earwax extractions, that's what's being used.
Yep, and that's what you're typically seeing whenever you watch his wax removal videos.
Got it.
Really get in there and see all the nitty gritty.
Got it.
Those are all done with a video otoscope.